All right, good evening, everyone. My name is Matthew Gillikin. I'm one of the co-chairs of Livable Seville. Livable Seville advocates for policies to build an inclusive Charlottesville area with affordable housing, sustainable transportation, and healthy neighborhoods welcoming to all. Homelessness is the most visible sign of Charlottesville's affordable housing crisis and housing shortage. Livable Seville believes strongly that housing is the solution to homelessness, and that any interventions related to homelessness that aren't ultimately directed towards getting people in housing are destined to fail. There's been a lot of things said, true and untrue, around the situation regarding homelessness in Charlottesville. And the aim of this webinar is to help us all understand this issue better, particularly as relates to the city's plans regarding the encampments by the Ravenna River, and the emergency shelter that's being established on Holiday Drive. I think many of you are familiar with the awful and dehumanizing things that are said about our neighbors who are experiencing homelessness on social media and elsewhere. We have to remember that we are all people, and that any effort to dehumanize any group, or to create a dynamic where people who are homeless are viewed as other is morally wrong, and also not reflective of what we want to accomplish as a community, and also leads to worsening of issues related to homelessness. Um, just let's be candid. There's a lot of, even amongst people that are of good faith trying to address this issue, a lot of disagreements, a lot of suspicion and concerns. We're gonna live in that tension and acknowledge that. And I think there's very reasonable skepticism about the city of Charlottesville around this topic. Just a year ago, the city attempted to effectively criminalize homelessness and make it illegal to sleep outside in Charlottesville. And there's a past history of the city attempting to criminalize panhandling on the downtown mall. And there's been many other efforts where the primary intervention from the city has been more along the lines of criminalization rather than housing. So the suspicion is real. I I share much of it, and but I think that there appear to be a few things going on that are heading in the right direction, and the goal of this webinar is to provide clarity on that. So we're here to learn, and we're here to help those in our community who are experiencing homelessness. Our speakers, our awesome speakers, are Shayla Washington, Executive Director of Blue Ridge Area Coalition for the Homeless, also known as BRAC. We're thrilled to have her. I think many of you are familiar with her. I think I'll just quick, I love seeing Shayla about town at basketball games. That's often where we cross paths. We also have Jen Fleischer, Charlottesville City Councilor, who's been leading a lot of these efforts from the city over the last few months. Jen is, among other things, a bass player, a designer, a surfer, and she was present at many of your births in her role as a doula. So she brings a lot to the table. And then Brittany Stanton is someone who is going to be new to all of you, and she's from the Central Arizona Shelter Services, CAS. She's the Chief Program Officer there. And she's here to tell us about CAS and the role that they're going to play at the new emergency shelter. Brittany spent the last decade providing social services in a variety of settings, including outpatient behavioral health, transitional housing for women and children, and permanent supportive housing for survivors of sex trafficking and those with serious mental illness determination, with a serious mental illness determination. She holds a bachelor's degree in psychology and criminology from Arizona State University. She is passionate about finding sustainable solutions to the housing crisis in her native Arizona and elsewhere through the principles of housing first, harm reduction, and trauma-informed care. So we're going to hear from each of our three speakers, and then we will go to Q&A, and then and again, put questions in the chat directed towards me, or send an email to livableseville@gmail.com. All right, Shayla, I'll hand it off to you.
Thanks, Matthew, and thank you, Stephen and Livable Seville, for hosting us today. I know this is a really sensitive and touchy topic, and I really appreciate everyone's interest in learning more. I will share my screen with you now. Hopefully everyone can see that. But as Matthew mentioned, my name is Shayla Washington. I'm the executive director of the Blue Ridge Area Coalition for the Homeless, which I'll be referring to as CAS from here on out. I'm sorry, not CAS, BRAC from here on out. And before I even kind of do a deeper dive into our local homelessness sector and what that looks like, just to explain to you a little bit about me. I have worked in homeless services for about 10 years here, and I became really interested in learning more about the system because I experienced it firsthand. Sleeping in my car, not feeling like I had a really good handle on the resources that were available here in Charlottesville, and feeling like it shouldn't be that complicated to access. And so once I got out of my homelessness crisis, I decided to learn more from the inside out and see if I could improve this system in any way I can, because no one should have to go through this crisis and feel like they're struggling to get through it without any help. Um, it's really good to see so many familiar faces on here. I'm sure I owe a lot of you some emails too. So um, all right, so next, Blue Ridge Area Coalition for the Homeless, or BRAC. We aim to make homelessness rare, brief, and non-recurring in our community. We collaborate with various regions in our catchment area to help individuals and families achieve housing stability, financial health, and improved quality of life. Really, we just want to ensure that there's a safety net for people who are experiencing homelessness and people who are at risk of experiencing homelessness, and make sure that they can quickly end that homelessness and move into housing. That's our goal. It doesn't always happen, but that is our aim. So what is a continuum of care, or a COC, and what is a COC lead agency? A COC is a broad regional planning body. So think of nonprofits, service providers, local government. We're all coordinating our efforts to prevent and end homelessness. The lead agency, or the COC lead agency, is the specific organization that's designated by that continuum of care to manage daily operations and funding applications, which is a big one. We are a HUD designated system, and HUD stands for the Department of Housing and Urban Development. We are one of 16 COCs across the state of Virginia, and all but 3 are regional or multi-jurisdictional. We're considered multi-jurisdictional in the sense that we have 5 different counties and 1 city that we serve, and they're all governed very differently. So our COC came to be back in 2004 when community stakeholders and local churches, especially in the downtown area, convened to fight homelessness after someone passed away who was unsheltered and he was living under a bridge. So the Blue Ridge Area Coalition for the Homeless came to be in 2009 as the official HUD designated COC lead agency to support the efforts of all that's happening in the homelessness world, not only in the city of Charlottesville and county of Albemarle, but Greene, Louisa, Fluvanna, and Nelson as well. We receive about $600,000 in HUD funds every year for permanent supportive housing and about $1.6 million in state and local funds. We actually distribute out about 1.1 million of that, so we only keep about 500,000 within our organization. Current system capacity. So on any given day in 2026, there's only 54 year-round emergency shelter beds for individuals experiencing homelessness. And these are some stats from the most recent years. So a full year at the Salvation Army last year, they served 346 unique individuals. Pacham, which is only open seasonally between November and April, served 245 unique individuals. As you can see, the number of beds that we have that are year round do not meet the needs of the folks who need a bed really all year round. This chart you'll actually also see on our website. This is our by name list, and the list is a list of everyone we know to be experiencing homelessness at as up to date as possible. So we have a lot of different service providers within our continuum of care feeding into this list, letting us know on a pretty regular basis, this person's sleeping outside, this person's in a shelter, this person's in their car. And as you can see, the general trend is the gold bar, which is 2026 numbers, are generally trending higher than 2025. So we're seeing an uptick in homelessness and not an uptick in shelter beds, not an uptick in housing.
Shayla, quick question, good
Sure.
question in the chat was when you talked about available beds, are those just in the city of Charlottesville and urban ring area, or is that in the whole BRAC catchment area?
That's pretty much the whole BRAC catchment area. There is an organization called the Louisa Homeless Coalition doing really great work in Louisa County, trying to model what Pacham does with congregations. They're having some issues trying to get.
Jen, I'm gonna kick it over to you, and if when Shayla pops back on, we will get her back with us. Um, so, Jen, talk to us a bit about. Oh, Sheila said, texted say her laptop decided to restart. That was convenient. So, Jen, tell us a little bit about the city's plans here, and if you could start by telling us what an emergency shelter is and why you think that's necessary at the moment.
Sure thing. So, the an emergency shelter is one that is temporary in its posture, so it can be functioning for in its original iteration for 12 months, with the with a rapid progression and sign off of all the necessities to make it a safe and livable space. So we will often use emergency shelter in environmental emergencies like floods or hurricanes. And generally speaking, in your mind, might look like a gym with cots in it. That's a FEMA emergency shelter option. We're using that same kind of classification to stand up the shelter at 2000 Holiday Drive, a building we purchased in the fall, in order to do so rapidly. But that shelter will eventually evolve into a permanent shelter. The difference of our emergency shelter and the FEMA ones I just mentioned is that this is made to be open for 12 months and will be much more comfortable than kind of the gym vision in your mind. It will be, designed to be something long term. The reason we are in an emergency posture is one, the pressurizing of weather. So the flood season in the along the Rivanna River down between Riverview Park and kind of Cosners and under the bridge at Freebridge are flood plains and flood fields where between September and October we generally we are most at risk for flooding. So knowing that we had folks living in that zone and were at a higher risk of flooding and danger, we kicked in the emergency process in order to stand up the shelter quickly in an effort to move those folks out before a flood might happen.
So this is all happening very quickly, which has pros and cons, I suppose. Um, Tell us a little bit about what the shelter is going to look like and when it's going to be ready in terms of the timeline, because this is all happening real fast.
Yeah, and happening real fast. The kicking into gear of the process to open the shelter has really been on a very condensed timeline, and that has lent itself to, like you said, a lot of great collaboration and cooperation between Martin Horn building out the space for us with Cass as the operator, with our COC, with support and staffing. But what it looks like in that hustle is a single floor, the first floor of Holiday Drive, which is all told 27,000 square feet. I can't remember how many square feet are the first floor, but a first floor divided into sleeping areas, one for men, one for women, with some office areas for case management, some programming areas for dining and other, case management meetings, and a welcoming area. And then we have showers and bathrooms in trailers outside of the building, just to accommodate the need to eventually do a full build out of this building. That was kind of the best way to accommodate that. So it looks like kind of dorm living, beds spaced out and each sleeping space its own. And then those other areas that have more private space, as well as a med doc, basically an isolation room that can be converted for anyone who needs to be isolated or kind of take a step away for a moment. So, yeah, that's the general layout.
So the city, a decision was made September 1st for the people to need to be out of the encampment sites along the Rivanna. Um, is the shelter going to be ready in time for that?
So as of now, the shelter will be ready by September 1st. Again, that date chosen because on average over time, the flooding has really begun here around between anytime between September 15th and 30th. So that gave some runway of buffer between our highest risk dates. And yeah, the shelter right now is on track to be open on that date and start receiving guests from both the build out perspective and the staffing piece, which staffing is coming locally with for our first week as we get our legs with some support from cast coming in Arizona as a support team for those first couple of weeks.
So, and again, people are going to want to know the details. Is this thing going to be open on August 30th? And
September 1st. It'll be
okay.
open September 1st. Yeah. there is I mean, if certainly if we can do if the stars align and we run into we have no even leaving room for error, we're ready to rock August 31st, then we could open the doors and start there, but we're really working on September 1st as the first day to receive guests.
And so there's definitely a concern that, September 1st, the city will, the shelter will not be able to receive at the capacity that's expected. What would that mean for people that are in these encampment sites by the river in terms of like if they're saying I'm able to go, want to go to this shelter, but you all are like, oh, I don't actually have beds. Like what's going to happen to them in that situation?
Certainly for folks who have and we who have designated that they are interested in shelter and wanting to move, we'll have a process for them to um, sign up for shifts to pack up and move over. And if that's not on September 1st because something happens where we absolutely cannot open the doors, we'll accommodate that rollover of time. I think maybe what you're also getting at is that there is signage here at the river that says that as of September 1st, this area is closed, which includes Zero East High and Free Bridge area, the two floodplains in question. And that at that point, the any camping will not be offered, and enforcement could begin for by law. But the real goal here is to get folks into shelter and or where they are a best fit. Certainly, we have been working down at the encampment with folks since July 20th to understand their needs better and where they would find a best fit in once the site is closed. And some folks are and have begun returning to family members in other localities and states. Some have chosen shelter options that were available to them. Some have chosen group housing that was available to them. So as we've engaged with folks, the goal is to get everyone to higher ground and inside safely and where they are they're best accommodated. And so we'll continue that process even if September 1st is delayed, the doors opened are delayed. We will continue to work to get them inside. Oh, you're muted.
Number of groups, family was leaving the house. Number of groups have, I think, very reasonably expressed concern that the city is going to start arresting people at a certain point in this process. Please help us understand kind of some of the thought processes here. Reasonable skepticism, I would say, to a hammer, everything is a nail. If we're being honest. But yeah, help us think through that.
That is definitely not the goal of this effort or this initiative. The priority is not to arrest people. The deadline is an incentive for both us as the city and for residents to work together to get folks into their best fit for housing. So though very much of the work we have been doing here in the engagement and the outreach with the teams, we're here 3 days a week, and we're here tonight, one evening a week to connect and build rapport with folks and connect them to services are following best practices that we have learned from cities who have had successful encampment transitions into housing. And the those cities have also come up against the the date of closing and the availability of law enforcement to intervene, but we are hoping we will not have to do that, and that we will help folks move where they want voluntarily, through that transition. So, know that every team member who is part of this, it's a broad city team that includes public works, public safety, Department of Human Services, and the support of council, and a big support financially from the CACF. Everyone is really on board to let's get folks inside, not let's arrest folks.
Okay. Thank you. One more thing, Jen. How many beds will be at the emergency shelter?
120 is the capacity for the shelter. That'll be there will be more beds available on the men's side. We'll probably see as we roll out. We know statistically from, again, other cities that have done this, that we won't have 120 people show up the first day, so we can accommodate that many. But we anticipate in the beginning months, probably there could be, an upwards of 50 men and 30 women that might come join us, and then we'll just keep accommodating until we reach that capacity at 120.
Okay, but the expectation is starting September 1st, at least 75, 80 folks may be there. Okay.
Yeah.
Jen, thank you very much. We're gonna go back to our good friend Shayla, whose laptop decided to have an attitude, and we're gonna let her pick back up. And I'll just mention to those who may have missed this at the beginning, for the chat function, if you have questions, you can directly chat with me, or you can email livableseville@gmail.com. We don't have a reply all chat situation here. So, and please ask questions. Like, we want to clarify everything as best we can. All right, back to you, Shayla.
Thanks, Matthew. And sorry, my computer decided to install updates in the middle of me talking. So happy to pick up where we left off. There was a question to the chat about does the 54 year-round beds include just the city of Charlottesville or our whole catchment area? And that is for our whole catchment area. I had mentioned I have been working really closely with the Louisa Homeless Coalition, and they're doing really great work out there, trying to start a Pacham-like congregation-based shelter model, but they're having issues getting that through the Board of Supervisors. And so I think they've been kind of putting people in their basement as needed, who are, whoever is sleeping outside and needs some help in that way. So, but yeah, the 54 year-round beds are only through the Salvation Army at this point. This chart is just a quick infographic that we pulled from our system performance measures. These are reported to HUD, or the Department of Housing and Urban Development, every year. This runs on the HUD, or federal fiscal year, so October 1st of 2024 through September 30th of 2025. So we saw 601 people, 582 households coming through shelter or transitional housing of some type. And you'll see from the bar graph below that our highest number of folks that we serve fall in the age range of 25 to age 54. However, we're seeing a really sharp uptick in the number of people who are experiencing homelessness who are elderly, so age 55 plus. And so that's just a target population we need to be on the lookout for, because some of our shelters can't adequately handle folks who are aging, who can't handle their activities of daily living. And so that's just something to be mindful of as we start to build out more shelter, build out hopefully more affordable housing, that it really is accessible to all, not just based on physical or disabling conditions, but based on the age of that person as well. Another highlight I'd like to point in your direction is the race category. And so, as we know, Black folks are typically overrepresented in the homelessness population. That's no surprise here. We're actually at about 46% for Black African American or African folks, as well as 46% for white. So they're actually even in terms of who comes through our system of care. And so disproportionate representation comes from a number of different things, redlining, gentrification. And so it's just really important to keep that in mind as we think about what types of housing options, what types of shelter options we're offering to the folks who are experiencing homelessness and making sure that it's equitable. And so all the work that we're doing, we're just doing this with a staff of 3. So I just wanted to call that out. I have 2 really great staff members, Anne and Catherine, who help support the operations of BRAC, but it is really hard to do all this work with just such a small staff, which is why we need more capacity. This infographic was designed by a friend of mine who works in communications, and I asked her to do kind of a roadmap of how to access different services in our homelessness continuum of care. And it's pretty complicated. I know when I was trying to navigate all the different services that were available when I was experiencing homelessness, I was very overwhelmed and felt like, where do I go? And so this just shows you how much we have to offer, but how sometimes disjointed it is, and it's not really easy to navigate. And so I just really wanted to throw this on here on the screen so you could see what all the different services are that we offer. We have coordinated entry, which means there's no wrong door for homeless services. We have different types of shelters. So the Haven for day shelter services, Pacham for seasonal, like really cold and rainy months, the Salvation Army year round. It's program based, so you do need to meet some criteria in order to stay there. And then the Shelter for Help and Emergency, which is for domestic violence survivors. We have rapid rehousing, we have affordable housing, we have transitional housing, we have permanent supportive housing, but all of these require different types of criteria in order to access them. And so I just wanted to call this out because we do have a lot of services and resources here, but they're extremely difficult to navigate if you don't know where to go. This chart is a little bit more simplified. It just kind of shows you what the housing and homeless assistance programs and services are and who offers them. You'll see on the left-hand side or the left column, all the different agencies that we have, and the ones with asterisks next to them are funded by BRAC in some way. But as you can see, we have a lot of rental assistance programs, different criteria for them. We don't have enough permanent supportive housing. We don't have enough rapid rehousing. And ideally, that's where we would like the city and all the other counties in our catchment area to move towards. So the 2 big topics that have been really hot button topics in our community are the encampment response and 2000 holiday drive. So I'll just touch on those briefly. As of June 8th, when I met with Chief Kochis and his team from the Charlottesville Police Department, they reported 118 individuals who were unhoused at Freebridge and 0 East High Street. That number has since steadily decreased because of folks hearing September 1st and then immediately kind of relocating elsewhere because that encampment is in a floodplain. We're worried about flood season, among other things. And let's just be real, there's a lot of attention being drawn, mostly negative, to the encampment. And so there is the desire, I think, from the city to have a really quick and rapid response to that, faster than our service providers can do, our local service providers can do, because there's just not enough capacity, as I mentioned on that previous slide about governance and operations. BRAC has awarded funds to support Works Housing for 2 homeless outreach positions. We just sent the MOU over today, and hopefully they'll be getting funding very soon within the next week. They have 2 people they want to hire and move forward with, so we're really excited about that. They'll be working closely with the City of Charlottesville's Human Services team of outreach workers once those folks are hired as well. So there will be more robust response. Unfortunately, it's a little bit late. It'll be after the encampment officially closes on September 1st, but at least they can be responding to other areas of need, like the downtown mall or other spots in the community where there's a high number of people who are sleeping unsheltered. I'm sure Jen touched on the encampment survey that was happening for 2 weeks to help inform the city with some of the planning needs and what we'll be doing at Holiday Drive. But the goal is to house as many people as possible from the encampment, giving them priority for 2000 Holiday Drive, and then working through a prioritization system with our local continuum of care to figure out who else can have a bed in that facility. So 2000 Holiday Drive, just so you know what the local providers have been working on, we're working on a coordinated response to permanent operations in the shelter. Cass is expected to be here for 12 months, and then hopefully the local service providers will be have the services turned over to them. So we're working really closely with the Charlottesville Area Community Foundation to determine what our COC's capacity needs are, and working with for a proposal for increasing those capacity needs across different organizations. And then we're submitting a request for proposals draft to the city manager, as well as an operations plan to the city manager by August 31st, so he can take that into consideration and figure out if either the city or if BRAC will be releasing the final request for proposals for an operating plan.
Sheila, one other thing. Oh, wait, go ahead. Sorry, you had another slide.
A
Go for it.
couple more slides and then I'm
Yeah,
done.
yeah.
So what else are we working on? We have a Coffee with the Continuum. This is our quarterly Continuum of Care membership event. It's open to any and all. It's free. It's this Friday at 9 a.m. At City Space. And so we're going to hear from Jen and a couple other folks from the city about their plans to move forward with the encampment process and 2000 Holiday Drive. And that more information about that's on our website. I'll forward to the next slide, which has a QR code that you can scan to take you directly to the events page. We're also trying to navigate shifting federal priorities. There's a lot going on at the federal level. The recent notice of funding opportunity by HUD was put through a lawsuit, and the lawsuit actually made it so that the current application is null and void. So we're just trying to figure that out and figure out what HUD is prioritizing for housing versus homelessness services, and it's ever changing. So we're always having to keep abreast of that. We're working on strategic plans for both BRAC and the whole continuum of care, doing long-term planning for 2000 Holiday Drive, supporting the Salvation Army and their new Center of Hope, bringing in more training and professional development for all of our continuum of care members. We have some new anonymous client feedback kiosks coming to the Salvation Army, the Haven, and Pashem this year. We're implementing those this month, so I'm really excited about that. And always just trying to make sure we center and include the perspective of people with lived expertise and experience, because they are the folks who inform this work and keep it moving in the best, most holistic way possible. This QR code, again, will take you to our training and events page. So if you're interested in attending the Coffee with the Continuum, you're welcome to scan that and learn more. And there's my contact information if folks have any questions.
Sheila, could you just briefly talk about Vista 29 and what role that's going to help in addressing this?
Absolutely. So Vista 29 will have 80 units coming online in January of next year. So currently our continuum of care is prioritizing folks who have chronic experiences of homelessness. And it's a very specific definition by HUD, but someone has to have a disabling condition and also have been homeless for either a year or more consistently, or 4 times or more in a 3-year period. And so these are the folks basically who've been homeless the longest and also are vulnerable to passing away on the streets if there's no housing interventions. And so that's who we're prioritizing for the 42 units that are earmarked for us through Vista 29. And we're going through our case conferencing twice a month to ensure that that list is solid and accurate. But that's the list that we'll be producing to the Albemarle County Office of Housing for those 42 units that have been designated for the COC.
Great. Thank you very much. So Jen, how about we go back to you and you introduce us to Cass and to Brittany and kind of tell us how Cass entered the picture here, and then you can hand it off to Brittany.
Super. So we were introduced to Cass through Richard Southey, who Brittany will explain his title and role in Cass, but to me, he was a guy at the Tea Bazaar one day, and he is here in Charlottesville and has been for the past year, as his partner finishes her PhD at UVA. And we had been starting to ask other nearby cities if they had experience in standing up emergency shelters, or could support us in that, knowing that we would need that capacity build, as Shayla said, there has been a long-term kind of underinvestment in homeless services and the continuum itself, and so that was showing up in the fact that we don't have the people to execute an emergency shelter. Those other agencies were like, no, we're up to our eyeballs too. We cannot help you. And Cass was like, oh, maybe we can. So we did some, Cass had a lot of experience since the 80s and currently runs a homeless campus in Maricopa County that serves 24 cities. And that led us to meet the Cass team and their board, which agreed to operate and support an emergency shelter on this temporary basis. And so Brittany was part of that leadership team that helped us better understand what that offering could look like. And so without further ado, she'll tell you more about Cass and those offerings.
Awesome. Thank you for that introduction, Jen. So as Matthew and Jen have said, I'm Brittany Stanton. I'm the Chief Programs Officer for Central Arizona Shelter Services, a nonprofit in the Phoenix area offering emergency shelter. I also am going to share some slides, hopefully. Give me 1 second. All right, I'm going to cross my fingers that that is showing up for everyone, and we'll go through. So quick history about me. My experience has, again, come from starting originally with community mental health services and then moved into sort of co-occurring housing, and then moved into homeless services, specifically about 4 years ago when I started with Cass. I'm going to move to the next slide, which will give you a visual on who Dr. Richard Southey is. So as Jen mentioned, Richard is our Director of Compliance and Continuous Improvement with Cass. He moved to Charlottesville last July to follow his wonderful fiance into her continuing her education for her PhD. And he continued on with Cass remotely in his new position. Richard has been working with Cass since COVID, where he was working as a rapid rehousing case manager, and he has moved up through program evaluation and program leadership positions until he is in his current role. During that time, he worked on his PhD in trauma and global health, focusing on trauma for sheltered individuals. And so Richard kind of has been the man on the ground so far in Charlottesville. He's been attending the public spaces work group, and so some of you may be familiar with his face, but you will be more familiar with him as we kind of continue through this process. So really appreciative of Cass's Richard's growing understanding of the local community. And we're really fortunate to kind of have him as part of the team to help connect Cass's perspective with Charlottesville. So who is Cass? Cass began more than 40 years ago as a collaborative community response to homelessness in the Phoenix area. And the spirit of that partnership has remained central to what we do. So our mission is to prevent and end homelessness among individuals and families while advancing compassionate community solutions. That last part is really important. We know homelessness is complex and the needs, resources, and systems surrounding it look different from one community to another. Our vision is simple in words, but a little bit harder in actually achieving. We really want to have a community where everyone has a home. So that vision guides how we make all of our decisions, how we design our programs, and how we have been working here in Phoenix with our local partners to create practical and sustainable solutions. So what's the most relevant to today's conversation is how that mission has translated into actual shelter capacity over time. So Cass runs 3 major programs. So what I think is really important to kind of note here is that it's not 3 versions of the same shelter. Each of them was developed around a different community need and a different population. So the Haven, our colorful building, is our newest shelter program. It's a 130 unit shelter specifically designed for adults aged 55 and older. And that program kind of grew out of what we learned about the needs of the older and medically vulnerable adults, especially during the pandemic. That was really highlighted. Vista Colina is our second oldest program, and it's a converted apartment complex that offers 30 units of non-congregate emergency shelter for families. And we recently made changes to that program that allows us to offer direct referrals into short-term shelter, which didn't previously exist in our continuum for families. And then our largest, probably most locally well-known program is our single adult 600 bed shelter, which we have run 24 hours a day, 365 days a year since we started offering services over 40 years ago. So even though the kind of models that we have for each of our programs looks different, the philosophy is the same. We want to reduce unnecessary barriers to accessing shelter. We want to meet people where they're at, and we want to keep the work focused on moving people to housing. So we don't want to end up being what people fear is like a warehouse. So something even more important to our discussion today than our current service is how CAS kind of came to be, and how we have kind of built our entire brand around responsiveness. So CAS was founded in 1984 because communities in the Phoenix area recognized that we needed emergency shelter capacity that didn't exist. So as the population experiencing homelessness changed, our programs have also changed. So when families needed a different type of shelter, we built family specific capacity. When our community recognized that people were navigating fragmented systems, we helped establish what became known as the Human Service Campus, or now Key Campus, bringing multiple organizations together to provide services in a one-stop shop. We've also had to learn to respond quickly during periods of crisis. So COVID, everyone kind of had to get it together. We partnered with the City of Phoenix to operate a hotel-based shelter for older and medically vulnerable adults who were particularly high risk in our congregate shelter. And so then we also expanded our main shelter from 470 beds to 600 beds as unsheltered homelessness continued to increase in our area. More recently, excuse me, we took what we learned from serving older adults in that COVID response hotel and opened the Haven, as I mentioned. And then Vista Colina, as I mentioned, we also adapted the existing infrastructure to respond to continuing family shelter needs. We have a prioritization list that we just saw continuing to grow, and folks not knowing how to continue to get connected to services. So we expanded that into crisis units as well. So kind of what I want to highlight is the common thread that CAS has repeatedly been asked to move our community, from we need something to we now have an operating program to address that issue. So that means more than putting beds in a building and people into beds. It means developing our staffing models, policies, intake documentation and systems, training, case management infrastructure, partnership with local organizations, and also just the day-to-day operations necessary to keep a low barrier shelter functioning around the clock. So I really think that that's kind of the experience we have that is the most relevant here. So as Jen and Shayla both touched on, our main focus is to both bring capacity and also build it here in Charlottesville. And so we can bring our capacity by contributing the existing infrastructure we already have, our 40 years of operational experience and the lessons kind of we've learned along the way. So we really hope that helps Charlottesville stand something up more quickly and avoid having to kind of learn the lessons that we've already done. But what we really want to do is build that capacity here. So we want to make sure that we're working with the local providers that already exist. We want to kind of leverage the partnerships that they have amongst each other and across sectors. And we want to share what we've learned. We hope that they share what they've learned doing the work. And we want to create an operational model that can sustain longer period of time here. So we really realized Charlottesville is not Phoenix, and our intention is not to copy and paste a Phoenix shelter into Charlottesville. we're going to bring some experience and we're going to bring some staffing and we're going to bring some capacity. But we really are going to lean on the local organizations, the COC, the city, lived experience by continuing to do um, the public work spaces work group, by having feedback from those residing in shelter to make this the best project it can be. And so also to kind of touch on what has been discussed before, what does Cass's timeline for being in Charlottesville look like? So right now we are still sort of functioning in a consulting capacity. An agreement has not officially been signed, but the conversations around it have been around a 12-month budget that was submitted and approved by the city. And then kind of continuing through the renovation cycle of that temporary setup that Jen mentioned. And so the the estimate we've received for that is that it could be 18 to 24 months because construction is variable. You never know if you're going to find bad pipes. So we will plan to stick around for that. But there will be an RFP that goes out based on our discussions with the city for a permanent operator, and Cass will be present to help make sure that the infrastructure that's been established transitions appropriately to that new provider.
Great. Thank you, all three of you. If you're in the audience and you have questions, we are moving to Q&A time, and there are a lot of questions, and I believe our speakers are able to stay a little bit longer. So this is the time to anything you're kind of thinking about. We won't necessarily be able to answer all the questions, but a lot of these are actually going to be for you, Brittany, but Jen, you can weigh on as some of them as well. But um, Brittany, I've heard some concerns from people who assist with harm reduction efforts in the city of Charlottesville about what policies might be used at the new shelter. And I guess I was hoping you could kind of speak on that question a little bit about how Cass approaches that, and then kind of also just seeing if you all would be willing to meet with the local experts on that topic to kind of help fine tune things.
Sure. So yeah, for how it will fully look in Charlottesville, I don't want to speak on that because I haven't spoken to the city or anything specifically on this topic. But the way Cass handles it in Phoenix is that generally things like Narcan are supplied by staff. Clients can have free access to it. It is available both on the campuses that we run and within our individual programs. We also partner with harm reduction agencies. A local one is Sonoran Prevention Works, and they do needle exchanges, they do Narcan, they do all of those kinds of things. We allow sealed, so Sonoran Prevention Works, knowing the shelter environment in Arizona in which they have been declared drug-free zones in which paraphernalia is part of that. But if there are clean needles, they have them in sealed packages, and clients are able to bring those in. And so if somebody does not have that, we are directing them to the partners who can provide those supplies to them. And so we have to be somewhat strict based on our local guidance on how we are able to handle that. And so that's where I will have to kind of touch base with Jen and the city to determine how Charlottesville approaches that.
Jen, is that something you have thoughts on at the moment, or is that still a TBD?
Yeah, I think we're still working some of those details out, but I think definitely the pieces to replicate of connecting to our providers. We're hoping to have also good connections with UVA Health and ongoing support there. So those are all in the works, and we're hoping to finalize all that within the next few days.
Okay, great. Um, Jen, could you talk a little bit about so a lot of outreach is happening, the Ravenna sites. There are many other locations throughout the city that have one or more people who are homeless living outside. Um, Is there also currently outreach to those folks elsewhere in terms of assessing them and seeing what their needs are and making sure they're aware of the opportunities available?
That's definitely the plan. Currently, we are just focusing on the river encampments, but the plan is to continue that outreach and that assessment process at any other places that we know there are folks living outside. So, fortunately, BRAC stood up a summer pit count, which we partnered with, and the assessment team and our volunteers assisted with for the river piece. And so we have a sense from that point in time count where folks are staying and where we can go next to reach them. I think we've had, because we started this in July, as Shayla mentioned, we did this July through the 20th through the 31st. And now that we've been down here continually, we've had a chance to kind of refine our process, and we feel like replicating it elsewhere can be successful, particularly with the conversation leading to there's an option shelter that was not before available. So we are hoping to move to those other places quite quickly after we get the Holiday Drive crew settled, and then carry on that outreach. And I should say that the city's committed to that as well. We, as Shayla mentioned, BRAC has helped with support works having 2 outreach workers. We hope to add to that cohort with 2 outreach workers for the city, which will be posting in the end of September. Right now, we're hiring for a supervisor of that program. So we will partner with those support works outreach workers to really make an impact, kind of learning from Cass's model, and Richard in particular has been a part of. They have 5 outreach workers at all times working around the clock, and I think that's a model we'd like to really begin and sustain here as well.
Brittany, can you talk a little bit about what um, low barrier shelter has a few different meanings for different people, and I know some things are being obviously kind of worked out as to what exactly that might mean at this site. But could you just describe for us what you're kind of anticipating low barrier shelter will mean in this context? And kind of there's questions, about where people will store their belongings and what belongings are allowed in, what are the behavioral expectations, and how it connects to other services. Could you just kind of lay out some of what you think that might look like?
Yeah, sure. So Cass generally kind of explains low barrier shelter as very few preconditions to being able to come in. Again, at our Phoenix locations, we have some restrictions that are part of either use permits or zoning. So for instance, we have a shelter that is located directly behind a school, so we cannot accept sex offenders at that location. Here in Charlottesville, that does not seem to be that it is going to be something that is going to be a barrier. So we are not checking someone's criminal history. We are not asking them to be sober. We are not asking them to have income. We are really just asking them to show up and give us a chance to help connect them to the next best place, which is hopefully housing. And so obviously, as we continue to kind of figure out what that landscape looks like, and as those new units become available, that is going to be where things are directed. It is also for belongings. We do not want the concept of I don't want to leave my stuff, and like maybe I understand I can't have it with me immediately in shelter or like at my bunk, be a thing that prevents somebody from coming inside. And so we're being very careful to figure out how much space we have, what is realistic about being able to bring things inside. And so we typically break our sort of prohibited items list into 2 categories, which is straight items that we cannot have on property, such as weapons, so no firearms, no explosives, things like that. And then an example of a restricted item would be if you have work tools, and you would use them potentially for your profession, or you just want to have them for wherever your housing is at the end. It would not be stored at your bedside, but it could be stored in safe, locked up storage somewhere else on property that you just wouldn't have immediate access to. If you are using them for your current trade, we would have hours in which you would be able to come and access that through staff. You would just sort of turn them in before returning to your bed. So the sort of details of what all of those specific items are is still being discussed, just so we can try to limit that being a barrier as much as possible for people coming inside. And I think you mentioned another specific thing, and I don't want to miss it.
Um, I'm not exactly sure.
Okay.
My brain's getting a little bit tired, but some we've been asked to like, what does food and meals look like? What is provided typically at your shelters, and what are you expecting here in Charlottesville?
So we would be working with other organizations to provide meals. So right now we're still kind of working on who that would be, but it would be a contracted service provider, similar to the Haven or other sort of catering options available for clients. In Phoenix, when we do provide meals through our organization and not through a partner on the same campus as us, we do also do contracts. We typically limit it to 2 meals per day because of the SNAP requirements and because of the sort of short-term nature of shelter. We want to limit anyone's ability, or we want to limit the barrier somebody may experience to try to turn those benefits on once they've entered housing. And so there's not that gap in services. So in Phoenix, we typically cover 2 meals a day. And we get the feedback that that allows somebody to still qualify for benefits. I'm not sure if that's exactly how it'll work in Charlottesville, but that is how we run it in Phoenix.
Um, Here's a maybe a question for Shayla, though kind of ties in for Jen and Brittany. So I'll start with you, Shayla, and then kind of go from there. Um, what are the approaches, Shayla, that amongst the current shelters, and I'm not asking you to fully speak for the new shelter, but for people who have pets, people who are in a relationship, a couple, and people who are not comfortable for a range of reasons and being in a single sex setting? What are kind of what are the options, and what do we need to do to create more options for those folks?
It's a great question. We have a lot of limitations as far as pets are concerned. Um, there just isn't really a capacity with our current shelter models to have pets. I know if they have documentation saying that they need that animal with them, I think that's something that a shelter could work through, but I haven't really seen that happen. I know the Salvation Army does not have or allow pets of any kind. And so we've discussed that with them, but I think it's a hard no at this point. Pachem, I can't really speak for them, but I don't think they handle pets either. That is something we've talked about pretty extensively as we talk about what we would like to see in the new iteration of Holiday Drive or 2000 Holiday Drive. And so, that could look like working with the SPCA or some other provider to provide kenneling services for animals, but that's definitely something that's on our radar to think through. As far as couples, we currently at the Salvation Army and Pachem, which are our current two shelters that we offer, folks are separated by gender. So, if a couple goes in, they're going to be split up for bedtime. And so that's not an ideal situation for a lot of couples who are experiencing homelessness and they'd rather sleep outside together. And I totally understand that. That is something that's also being talked through for Holiday Drive. As far as folks who are gender neutral, non-binary, don't feel comfortable identifying with one particular gender or another, we are looking into gender neutral spaces as well for Holiday Drive. And I know Pachem will honor whatever gendered side that someone wants to sleep on wherever they feel most comfortable. So that's kind of how we're handling it here. We recognize that we're pretty behind the times, I think, in terms of like couples and pets and things of that nature. And so that's why we really want to be mindful about having the best possible setup for everyone, or as many subpopulations as we can of people experiencing homelessness for Holiday Drive.
Great. Jen, our our frenemy UVA has a hospital and a health system. Are they how are they involved in some of these conversations? Or are they involved? And what is being done to make sure that people at the Holiday Drive shelter are being given access to quality medical care?
Yeah, I can speak to that. And I'll just jump on the end of what Shayla was saying. For the emergency shelter posture, there will be one pet allowed per person. They'll stay with their person and need to be supervised by their person. Um, but as she mentioned, it is gender separated for sleeping only. All other times are open to couples hanging out. And there will be, yeah, and as she mentioned with Pacham, the guest chooses the side they'd like to sleep on, and then working from there, if there's any complications or problems, we have some others. There'll be some other neutral space for to accommodate folks. So UVA was extraordinarily helpful in the assessment phase. We had students and faculty from both the med school and nursing come and help lead the charge and provide clinical expertise, not services per se, but definitely the connections and the kind of assessment side of clinical care to the folks down here that at the river who are needing those services, and helped to kind of create longer term clinical programs for them while they were on board with us. In the longer term, we have had conversations with UVA leadership, and they're very interested in supporting the shelter both in its emergency and permanent state and providing clinical care. That is being discussed and worked out now. Whether that will show up on site or in the mobile unit is to be seen, but those details being worked out. And then ultimately, I think there's a big need for respite care so that folks who are being discharged from any hospital in the area have a place to go where they can receive their clinical care that cannot be served outside or even in a shelter to meet their medical needs. And those conversations have just begun. We're speaking with some experts at UVA Med on that, and leadership will get looped into that too. But I think our goal is let's really build out the system and have UVA be both a clinical and financial supporter of that system. And that will include, of course, COC, but also UVA and Centera and our FQHC in the area, Central Virginia Health Services, and really Region 10, broaden out the physical and mental health capacity of clinicians to reach our unhoused neighbors and to provide sustainable care with impact. And so I think that, obviously that system will include public safety, public health, and business and workforce and all the things that we can envision a robust homeless services ecosystem should have. And UVA certainly has to play a large role in that.
All right, we are closing up, but I want to have the three of you answer what I'm about to ask. We've had a bunch of people asking, what can I do to help out? What are ways I can support? So I would love for each of you to share from your corner just a range of things, just a list of options and how people could potentially contact to get involved with those options. So Shayla, you already listed some things, but if you want to relist those and add anything else in terms of people wanting to get involved in various ways to support some of these efforts.
I think education and advocacy would be the biggest ones for BRAC. We don't really have a lot of volunteer opportunities other than our point in time count, which just passed, but there's another one happening in January. So be thinking about that if you're interested. But yeah, just educating yourself about homelessness, educating other folks who don't understand and maybe have very negative opinions about the encampment and what's happening at Holiday Drive. I'm always happy to meet with someone and talk to them one-on-one about homelessness and just make sure people are aware of what's going on and have the best information possible, recognizing that this is a very rapidly changing scene with what's happening locally. So, and just continue to advocate for folks, not just shelter, because shelter doesn't end homelessness, housing does. And so continue to advocate for low income housing, affordable housing, vouchers, permanent supportive housing. All the different buckets along our continuum are so important to keep filling.
Brittany, do you want to share if people want to connect with Cass or get involved with your efforts here?
Sure. Obviously, as we kind of start running the shelter, we'll kind of see what more of, opportunities are available. But Cass loves volunteers, and so there are things from running like donation drives. It is going to get cold soon, so we like. Usually for us, it's heat relief type things, but we would need cold weather clothing for Charlottesville. We also love mealtime handouts. So if we are doing prepackaged, prepared meals, if someone would like to come and do companionship at the shelter, you can do a mealtime, you can hang out, you can run games, you can um, run a book club, whatever is your fancy. If you would like to help with like laundry services or accessing to be able to increase the number of hours people can have to that sort of extra storage, if you would like to kind of come in that capacity. So obviously, again, like I said, I'm speaking more towards historical volunteer opportunities that we've had available, but it seems that these would fit within the workflow of what would be happening there.
And who would people contact, or how would people get in touch with Cass if they were wanting to do that?
Richard Southey is going to be our main point of contact there, and I can provide, I know you have his contact information, but also someone can reach out to me as well. We, in the sort of proposed budget, did include a volunteer coordinator, which may be staffed by a third party rather than Cass, but that is sort of in the process there. And so as soon as we get information on who that might be as well, we can share that.
Okay, wonderful. All right, Jen,
So of course I'll round out all these asks with money, city. So that seems on brand for the city to ask for. So
you're going to be
we
asking yourself for money as city councilor?
asking, am I allowed to ask for money? Does that some conflict of interest? But it certainly this is financial support for the entire ecosystem supports even the emergency shelter. So Pacham will be standing up its shelter this season as well. There is, and they can receive donations directly. Certainly for the city effort, CACF is holding the fund for homeless services. Any contribution can be made there to the Charlottesville Area Community Foundation, and that can also support the continuum and the ecosystem, as well as the emergency shelter. We will be looking for the volunteer parts that Brittany mentioned, food support. We're really hoping to most of the food right now we're thinking about will be packaged and brought in and delivered. So that kind of networking connection, but also for congregations and faith-based organizations that work with Pacham and that maybe don't have the space to host, but participate in Pacham services, we're happy to broaden that scope and their offerings and connect them to the shelter to provide the companionship, meal support, driving support. So volunteering will be again through when the volunteer coordinator is staffed, ultimately through that person. But if for now, through Pacham and through CACF will be great ways to connect to the work.
All right. Thank you all so much. Thank you to our audience for your passion for this topic and your interest in helping to make our community a better place for everyone, including those experiencing homelessness. The recording of this will go up on the Livable Seville YouTube page in a day or so. Thank you, Jen. Thank you, Brittany. Thank you, Shayla. We greatly appreciate the work you're doing, and thank you for giving us some of your time. Everyone, have a great evening. Thank you so much.
Thank you.